Welcome back to the Blue Shark Show. Today's segment will kind of bounce off of episode 57. And today we're going to still talk about the workshop on June 16th and Commissioner Court on June 22nd of 2021, having to do with the American Rescue Plan. Now, if you remember, that was HB 1319. That was, I believe, $1.9 trillion from the federal government to help with the cities, the counties, and the states for COVID response. While I was doing more research into this workshop, I noticed a grant that Dr. Becky Early-Royer, the Deputy Regional Director for the Department of Texas Health Services, had mentioned. And she mentioned a grant called the Equity Grant. Now, we've been talking about critical race theory, CRT. And one of the buzzwords in CRT is equity, correct? Not equality, but equity. So when Dr. Becky Early-Royer mentioned the Equity Grant, I started looking into this.
But to be eligible to apply for that money, you have to be recognized as a local health entity or a department. We also have a fairly large health equity grant that is available to local health departments at the time now.
So there you have it, folks. There's a grant. It is the Health Equity Grant that has to do with CRT, social justice, and the Deputy Regional Director is talking about grants that Hood County can use for a health clinic. Now, who's going to be looking at these grants and deciding on whether there's strings attached or not? Our own judge, Judge Massengale, said he didn't want anything to do with CRT or anything associated with that in these grants.
To make sure that there's not anything that subjects this county to teaching or accepting anything that remotely touches the critical race theory or any of that propaganda.
So what happens if Hood County doesn't have these grants, or we don't accept them because of CRT or social justice or whatever the question's going to be? Then the county's going to have to fill in or backfill that money to keep these clinics floating. And here's another catch, folks. Dr. Blocker and Jay Webster keep talking about education.
Health education and events. That's kind of going to be the heavy side of that, is doing our health education events.
So when you educate the public on vaccinations, STDs, whatever a health clinic may be, you're going to be using federal tax dollars to do that. And the tax dollars will come from grants like the Health Equity Grant. And let me tell you who's part of the Health Equity Grant. The Health Equity Grant is in conjunction with Texas Health Institute and the Texas Health and Human Services Department for the state of Texas. So they work together, they partner together for this, and the website is texashealthinstitute.org, and it's about social justice. So if we accept this grant as a county, you're going to be locked into doing what the Texas Health Institute wants to do as far as educating, or I would call re-educating, your population. Now, we have heard on the news lately about Jen Psaki and her statements about what the Biden administration wants to do to go door to door and ask people about being vaccinated. And first of all, you have to ask, do they have a list?
The president will outline 5 areas his team is focused on to get more Americans vaccinated. 1, targeted community-by-community, door-to-door outreach to get remaining Americans vaccinated by ensuring they have the information they need on how both safe and accessible the vaccine is.
It should be up to the people if they want to be vaccinated or not be vaccinated. So here's the problem with that. You're not going to get people from Washington, D.C. coming down here. You're going to get people from your own county underneath the TexasHealthInstitute.org, underneath the Health Equity Grant and similar grants coming to your neighborhoods from your county through Jay Webster and through Dr. Blocker, who accept these grants on behalf of the county. And those people will be in charge of educating re-educating or having your community learn about these certain things. So that's how the federal government's going to get into Hood County and other counties here in the state of Texas. So when you look into the TexasHealthInstitute.org and you look at their website, and they have some PowerPoints, you can look at some of these pages, and they talk about 6 impact statements, and number 5 is Health Equity Improvement Initiative. There you go, folks, social justice. Then you can go to other different slides, allocation of funding, their state agency partners. So that's our tax dollars being used for this. Then it goes to a page for their values. And they talk about accountability, compassion, innovation, integrity. And then at the bottom, they list social justice. We believe everyone should have an equitable, not equal, but equity, that word again, equitable opportunity to achieve optimal health. So that's what's coming down the road for Hood County. Who's going to pick and choose these grants? Who's going to do the research to see what strings are attached? Do you think the county judge is? Maybe. Do you think we're going to hire a grant writer to do that? Maybe. Are we just in it for the money? Don't know. That would be a commissioner court decision. So when we look at this healthcare center, healthcare unit, whatever we want to call it, we're going to be faced with some very big issues coming forward with the money from the Biden administration coming into Hood County. So we better figure out how we're going to use this money with no strings attached, and it looks more and more like a wastewater treatment plant is the way to go. And wastewater is one of the approved options for this grant. Now, many people have talked about saying, hey, let's take this $6 million and give it back to the citizens of Hood County. And in order to do that, your commissioner's court is going to have to pick winners and losers. Who does it go to? Does it go to business? Does it go to individuals? Does it go to ad valorem property taxes? Is it only going to be property owners? So when you start giving back the people's money, who does it go to and where is it needed, since the government already took your money? And I think personally that they shouldn't have taken it to begin with, $1.9 trillion. It shouldn't have been passed, but it was. So while the money's here in Hood County and we desperately need a wastewater treatment plant, I think the city and the county need to get together and look at a regional wastewater treatment facility. So once again, folks, what it looks like to me is we definitely need to have more workshops. There has to be a lot of research done by Jay Webster, by Dr. Blocker, and everybody involved, especially the Commissioner's Court, on how this money is going to be spent. There needs to be meetings with the city, and we have to get this solved because the infrastructure crisis here in Hood County is not going to get better unless we do something about it now. Thank you for watching. Shark Show is here for you, the citizens, shining a light on your elected and appointed officials. Shark Show out.